Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course.
So my name is Dilshad Burman. I am a writer and reporter with City and 680 News. And the way this works is we have been collecting questions from our viewers and listeners over the past week, and we'll be presenting them to the doctor today. Now, she's never heard them before. It's all off the cuff. Nothing is pre-planned. And if you haven't had a chance to submit questions, you can still do so in the live chat in this broadcast, and we'll try to get to as many questions as we can in this short 30-minute period that we have with the doctor. So what I'm going to do now is we're going to start with our cache of collected questions. We usually start with vaccine questions because that's been top of mind for quite a while for most people, and it seems to be very urgent. And then we'll try and squeeze in as many other non-vaccine related questions as we can. So doctor, are you ready to go?
Yeah, let's go.
Excellent. So let's get this started. We are going to start with, as I said, vaccine questions, and we'll start with Jen's question. Jen has a question about natural immunity, and we've been seeing this more and more recently. So Jen says, why isn't natural immunity being considered as effective protection against the virus? She cites a study from John Hopkins University that says that natural immunity is 7 times more effective than the vaccine. And so would there be a case where you could reference specifically that a person with only natural immunity was reinfected? This way we could ensure that vulnerable people around the world have access to the vaccine and protection rather than holding back doses for those who have natural immunity and may not need it.
Okay, well, actually in Ontario now, if you recently got COVID and were cleared in the last 90 days, that's actually taken into account in terms of whether you need to self-isolate. For example, if you were exposed to someone who had COVID, you're actually treated the same as vaccinated individuals, but it's only given for a 90-day period. It's not beyond that. And it's because really after 90 days, you really can't guarantee how strong your protection will be after the COVID infection that you had.
Okay. And then again, another question about natural immunity, Irina asks, how is the synthetic immunity from the vaccines better than the natural immunity that you get perhaps after getting a COVID infection?
Yeah, we're still learning a lot about immunity, and it's, you know, why do we get colds many times a year, even by the same virus? Like, why do we get a cold every year, even by a coronavirus? For some reason, some viruses, some infections don't lead to lifelong immunity, where some do. If you actually got a natural measles infection, a natural chickenpox infection, you would have that mostly lifelong natural immunity that lasts. Yes. But it's not the case for all viruses, especially those respiratory viruses. That's why they bother us every year. Right. And so you usually do have that short-term immunity, and that's why, you know, in Ontario, we're allowing kind of that 90-day period. But we do know that you can get infected again. We know that that immunity doesn't last. What about vaccines? Well, you're getting more than one vaccine. Most of them are more than one vaccine. Yeah. And that second dose acts to boost your immunity. And again, we're still waiting to see, even with the 2 doses of, say, a Pfizer or a mixed messenger RNA series, do you need a 3rd booster dose? Some people are recommended that right now, and we're waiting to see how long that immunity does last, or how strong it stays strong for.
Right. Okay, and then, okay, let's go to Paula's question. Paula says, when traveling by air within Canada, does an individual require testing when they arrive if they're still fully vaccinated? If they're already fully vaccinated?
So I recommend that you follow the federal guidelines. They're always changing, and so that's why I never want to speak for those guidelines. Right now, as I understand it, even if you're vaccinated, you're required to have testing done, though.
Okay, and then we have a live question coming in here from YouTube. Ronald asks, COVID-19 was known of in November of 2019, and it hit Canada in Jan of 2020 to December, and then, sorry, it hit Canada from January 2020 to December 2020. There was no vaccine. So what therapeutics and prophylaxis had the best results during that time against COVID?
Well, I think the best prophylaxis was actually lockdowns. I mean, we actually saw that staying at home was actually the best way to prevent the spread of COVID. That's not possible to continue doing that in everyday life. And I think we all have suffered because of that. It's been quite challenging. So I think if you want the best way to prevent COVID without a vaccine is really to have no interactions with other humans.
Right, absolutely. But Doctor, we've talked about this a lot in terms of medications, therapeutics that are being given even to people in hospital. Are there any sort of names that you can give us? Because I know that ivermectin is thrown around a lot, but we've talked about ivermectin not being effective against COVID. So what is effective against COVID?
Yeah, I mean, there are constantly updates to the treatment regimens for COVID. In fact, the Science Table recently put something out. It depends on what kind of COVID you get. Do you have a COVID that you can stay at home and be treated and have no symptoms? Well, in that case, you would just treat with over-the-counter medications.
Right.
Versus if you have some difficulties with your breathing or cough, there might be puffers that might be recommended, maybe steroids. And there might be specific antiviral medications that might be recommended as well as recommendations for whether you should go on medications to prevent clots. I mean, so there are a number of different therapeutics that have come around, and it depends really on the type of COVID that you have, how sick you are with COVID.
Okay. And then another live question coming in, I think from YouTube as well. Star Child asks, the vaccines are showing to be less and less effective against the new variants. So why are we now pushing booster shots?
Actually, that's not true. I mean, the variants that we've had in Canada, 4 main variants, the vaccines are effective against them. And even against the Delta variant, it's the 2 doses that you need to be protected.
Right.
And I know, if you think about, 80% of people who are getting COVID are unvaccinated, even in our own province. So then you ask, well, what about those 20% who are vaccinated? Why are they getting COVID? Well, they're getting a milder case of COVID. The hospitalizations are still predominantly in unvaccinated people. And so that means the vaccines actually are still working. Now, what about booster shots? Well, not everyone got the best immune response against the vaccine. And so that's why in long-term care homes, their residents, if you had a cancer, a blood cancer, or have an organ transplant, you're recommended to get a booster dose. And that's being followed quite closely. Maybe all of us need a booster dose. We don't know right now. But I think we've been saying even throughout the year here that if it's necessary in the future, that's something that will be recommended.
Okay. And then let's take another live question before we go back to our cache here. Jan M asks, I got COVID on August 1st, 2021. When can I have my second vaccine dose?
Well, I'm sorry that you got COVID and you got it with 1 dose of vaccine. I mean, we do know with this Delta variant that 1 dose of vaccine does not give you that great protection. I'm glad that you're better, and I would recommend that you get the second dose as long as you have that 1-month interval from your first dose. And as long as you're no longer self-isolating, you can certainly go ahead and get that second dose of vaccine.
Okay. So let's jump back into our cache here of questions. This is the person's alias. Slow But Sure asks, are there any COVID-19 vaccines that don't use fetal cell lines in production?
Yes, actually, the Moderna and Pfizer vaccines don't use fetal cell lines. So the 2 vaccines that are available here in Ontario do not use those fetal cell lines.
Okay. And then Marguerite asks, and this is interesting. So Marguerite asks, what does unvaccinated actually imply? Does it mean that the person has had only 1 dose, or that they've had 2 doses, but and it's been only less than 2 weeks? Or does it refer to somebody who has absolutely 0 shots? Can you please clear this up?
Yeah, good question. It is complicated. So let's actually turn it around. Fully vaccinated means that you've had, if it's a 2-dose vaccine, you've had 2 doses, 14 days or more after your second dose. Partially vaccinated is the term that we use for someone who's just had 1 dose and hasn't had their second dose, or if they've had 2 doses and they get COVID, say, on day 1 after their second dose, we call that partially vaccinated. And then unvaccinated refers to someone who has not been vaccinated at all.
Okay, okay, so 0 shots. Okay.
Yeah.
Okay, and then let's take Anna's question. Have there been reported cases of people who were fully vaccinated with the COVID vaccine and later contracted COVID and are now suffering from long COVID?
It's a good question. We don't have very good stats on long COVID, unfortunately. Usually, what I can say is I can tell you for our Toronto data between May to August, all the cases of COVID that we've had, 99% of people who were hospitalized were unvaccinated. So, you know, if you had a severe case of COVID and got long COVID because of that, it's mostly in the unvaccinated.
Okay, okay. And let's move on to, so Jerry and Charles have a very similar question. Are the vaccines still only approved for emergency use? And if so, when can we expect official approval of the vaccines?
Okay, so in Canada, we call it the interim orders. We don't use that term emergency use, but it's the same idea. The interim order expires after a year, which is in September. And at that time, coming up, like in the next many weeks, Health Canada will approve the vaccines to be fully authorized.
Okay. Okay, Jerry asks, and this is a little bit interesting. Okay, I read a story about what was happening in Iceland. Vaccinated people apparently are spreading COVID at the same rate as unvaccinated people. Is this true? And if so, what is the purpose of singling out the unvaccinated, and what is the purpose of vaccine passports?
Okay, so I can't speak for Iceland. I certainly can't. There is no question, though, that the vaccines, they're not 100%. I mean, they're very, very effective at keeping you out of hospital, but you can still get COVID with the vaccines. And that's why we really want you to, I mean, getting vaccinated is still the best option, but still wear a mask, keep a distance, stay out of those indoor crowded settings, so that you don't run the risk of getting COVID. If you're vaccinated and you get COVID, you can still spread it. It's very unlikely for vaccinated people to unknowingly spread COVID. I mean, it's as much as in unvaccinated people who don't have symptoms. You know, there are those asymptomatics that can still spread COVID. And that's why we have to continue with those other measures, especially as we're in our 4th wave and COVID is here and it is circulating.
Yeah, absolutely. Okay. Let's take this question from Eric. If Ontario institutes a vaccine passport mandate, how will it be handled, for instance, at a sporting event? Will fans still be required to wear masks because the virus can be caught when fully vaccinated? And won't this just cause more stress for fully vaccinated people when, say, they are shopping at grocery stores among those who are not vaccinated?
Yeah, it's a good question. It's hard to tell you what the policy is going to be for going to see one of our professional sporting events because the full details haven't come out yet. Originally, it was noted, you know, vaccinate or have a negative result. But as vaccine passports come about, we're seeing more places are saying only vaccinated. And so we don't have the full details yet. And also the regulations, it's the provincial regulations under what's called the Reopening Ontario Act that require that masks are still worn in indoor settings, vaccinated or not.
Right. Okay, let's go back to our cache here. Matt asks, is there a graph with case counts by unvaccinated versus vaccinated and the corresponding death rate that incorporates the variant details? Is that data available?
Yeah, there's a lot more data on vaccinated and unvaccinated cases, on variants. There's a lot of places to look for the information. I mean, if you live in Toronto, we have a lot of information on the Toronto Public Health website. The Ministry of Health has information. And then Public Health Ontario, a lot of people don't know about this, but they are our scientific body for public health in Ontario. And they actually release a daily report, and it has information about variants. It also has information by region as well.
Okay, perfect. And then we've talked about myocarditis a lot. So George says, I have heart inflammation. Is it still safe for me to get the COVID-19 shot?
Yeah, it's a good question. I would really recommend that you talk to your cardiologist about it. I know that many cardiologists are still recommending the vaccine because even if you have an existing heart condition, if you were to get COVID, it could be that much worse even compared to vaccination. But definitely recommend that you speak to your cardiologist about this.
Okay. And let's jump in to another question from Joe. Joe asks, I am confused. If we get vaccinated, why are we not removing social distancing? COVID will eventually be like the flu. So if restrictions are not removed, then why should we bother with vaccinations? Why do I still have to follow restrictions? I get the fact that it is just for your safety, but Joe says, I need more than it's just for your safety.
Okay, I mean, part of it, Joe, is because right now we started the fourth wave, and so there's a lot of COVID circulating. And, you know, we really want to prevent the spread of COVID. We really want to prevent, you know, our hospitals being filled with severe cases of COVID. Getting vaccinated will help to prevent that. We know that if you're unvaccinated, you're 7 to 8 times more likely to catch COVID. And so that's how vaccination helps. But even if you're vaccinated, we know that you can catch COVID. And so wearing a mask is going to reduce that risk that much more. I mean, the vaccines help get you most of the way, but we still need to kind of keep that distance and wear a mask, especially in the highest risk settings. I mean, it's those indoor crowded spaces, again, where we're seeing the virus spread more easily compared to being outdoors.
Right, absolutely. And we'll jump into some live questions that are coming in right now. Phil asks, if the side effects and deaths are quite higher than compared to other vaccines, how can we justify giving multiple boosters to people in the future?
Okay, so I certainly don't know that that comment is correct, that the side effects or the deaths are higher with this vaccine. I have not seen that's the case. There certainly are side effects related to the vaccine, some rare ones that we need to be mindful of. But in terms of boosters, yes, you know, how safe are boosters? That's one of the questions that we have to be able to answer before we recommend boosters. I mean, we don't want to end up giving boosters that are not needed and that may end up in side effects for people.
Right. And let's see the next question here. Kim asks, should offices be opening in the fourth wave if remote work is possible? Is it reckless to open during this time?
So it's a really good question. I think, you know, as we start to see how wave 4 unfolds, we'll have to see what the public health guidance is that comes out. There is no question that virtual, remote, I mean, those are still lower risk settings. I do know that offices that are planning their return to work are often doing it quite with a lot of measures in place, including having vaccination policies. You know, only vaccinated can attend, they have to be masked, still physical distance, minimal numbers. And so I think, you know, the guidance may change as the weeks change as well.
Right. And as we've seen throughout COVID, I mean, guidances are changing often, things are moving, it's like a moving target, right? So we have to keep moving, as you mentioned before, the guidelines, the restrictions, everything moves as COVID moves.
Yes, unfortunately, for those people that don't like change, unfortunately, it's challenging that way.
Yeah, it's been challenging in general for sure. Okay, let's take up Jag's question again, coming in live. He says, we are being told the Pfizer vaccine after 4 to 5 months is just 37% effective, according to Israel. Why should people still get vaccinated?
Okay, so I'm not certain that that's the data that we have here in Ontario. We actually have very good data on effectiveness. What we have actually, for example, in long-term care homes is actually not real evidence that our effectiveness has gone down, definitely not that low, but based on some of the studies that have checked immune response in our most vulnerable, like long-term care homes, they've seen a decrease, and that's why a third dose is being recommended. There's also a slighter increase in cases among residents in long-term care who are fully vaccinated. Again, ever so slight, 2.5% of residents, you know, getting COVID in these settings compared to, less than 1% in other settings. And so those are the reasons why the booster dose is being recommended for those specific groups. But the vaccine effectiveness in Ontario is certainly not that low, as you've described.
Even after 4 to 5 months, do we have that data already?
Even so, what you would find is that among those who are who have had 2 doses and are getting COVID, is it mostly occurring in people who were vaccinated 4 to 5 months ago? And no, that pattern has not been observed yet. Right. Again, under active public health scrutiny. Yeah.
Right. Absolutely. Okay. Let's quickly jump back into our submitted questions. We have a few more minutes. Good. Tisa asks, my son is age 22 and had severe myocarditis after his first shot. He has to get his second shot, but he was refused at his visit to get a second shot. His cardiologist has told him that he needs to get one, and he's supposed to attend college in Toronto in September. Is it safe for him to get the second shot?
Okay, so I think it's going to be up to his cardiologist who has seen him following the myocarditis after the first dose to give guidance on that second dose. It's going to be very specific to the individual. Some people are being recommended to wait, to only just get that first dose for now until we know when to give that second dose. It's going to be based on that conversation with their healthcare provider.
Okay. Okay, let's take Bridget's question. Bridget is from Twitter. Their handle is Miss Birdie. They ask, if someone is fully vaccinated and is infected with COVID, is it less likely that they will pass it on to my unvaccinated young kids compared to someone who isn't vaccinated and infected with COVID?
Okay, what I can certainly say is they're less likely to end up in hospital. They're less likely to get a severe infection. How infectious they are, you know what, there's varying kinds of research and results on that. Some saying less viral load, some saying maybe more, so I don't quite have that definitive answer right now. We saw that even earlier on. It's not unexpected in science until we get enough studies in place to know where that answer lands in terms of how infectious vaccinated people are. It is the reason why we do say, if you are vaccinated and you test positive, you still need to self-isolate. We recommend, that you wear a mask. If you're in a home with other children and you're positive, keep that mask on, keep that distance as much as possible.
Right. Okay. All right, let's go to Nicoletta. Nicoletta asks, could I be denied seeing a doctor for an in-person consultation if I'm not vaccinated? I'm asking because my daughter is not vaccinated and she was denied an in-person consultation at a walk-in clinic because of it.
Okay, I certainly can't speak for the policies at, walk-in clinics, for example. In general, the principle is for essential services, whether you're vaccinated or not, you should not be denied them if it's an essential service. But what it means is that those other layers of protection are required, like PPE, like screening, like all of those other situations are required.
Right. And that's it for vaccine questions. We have a few minutes, so we'll squeeze in some non-vaccine questions. Let's talk about, once again, we've got natural immunity questions here. Phil asks, I'd like to know how come they aren't tracking natural immunity cases, people who have had COVID, and how they figure into the stats, either for new COVID cases or the goal towards herd immunity. So are we tracking people who have natural immunity?
Actually, yes, but it's in a different way. So there is actually an immunity task force federally. There's actually research being done in Ontario as well. Some of it is, for example, using blood samples of blood that was collected for routine testing and then checking to see how immune people are. This is actually how we knew last year, in the spring, that actually more people got COVID than tested positive because we were able to do some of this research. So in that way, it is being tracked.
Okay. And then Jeff asks, when you get a COVID test, it only tells you that you have COVID and not what type of COVID. So how are they determining that all of these people got the Delta variant of COVID?
Okay, so the test then goes on for further testing to see whether it's certain gene positive or negative, and based on what the results are, you can determine what type of variant it is. And so the strategy has just now changed, where it's going to be more surveillance based on a percentage of samples. Previously, it was all samples that had this testing done as well.
Okay.
So for your individual, if you're wondering specifically, many weeks after you get your positive, you could follow up with your doctor to see if there's further information. Most doctors have access to the computer system, and it should be available in there. The other place is public health often gets that result. And so while you're doing your 10-day self-isolation, you could ask the investigator who's, who you're dealing with, if they have received the results for what type of, whether it was a variant or what type of variant it was, and they may have the results as well.
Okay. So it's definitely possible for you to find out even personally whether you had the Delta variant or any other variant for that matter. Okay. Okay. Concerned asks, when it comes to indoor fitness classes like yoga, is 6 feet distancing enough to keep you safe? There's a lot of exhaling going on, and I'm worried that in a closed room for something like hot yoga, the chances of spreading the virus are very high.
It's a very good point. And I actually think that distance is really important. If you can wear a mask, that's actually very helpful as well too. What's probably one of our biggest things in a situation like that is ventilation, actually. And so that's maybe one thing that you want to find out from the gym. How good is the ventilation in the room where you're having yoga? Can the yoga be taken outdoors? Can you join an outdoor class? That certainly will be safer, even more safe than increasing your distance between participants.
Absolutely. And okay, let's take this last live question coming in because we're almost out of time. Sammy asks, I guess because we've been talking about getting COVID and natural immunity, getting COVID doesn't give you antibodies?
Getting COVID gives you immunity, and we say that the immunity lasts for at least 90 days. But beyond that, it's really hard to determine whose immunity lasts for longer than that. Some people it wanes right away, some people it lasts longer. And so that's why, but we can at least say for 90 days following your infection, you're considered to have natural immunity.
Okay, wonderful. So that brings us to 1 o'clock. That half hour just goes by so fast these days. Thank you to everybody for all your wonderful live questions and for participating. Thank you to the doctor for taking the time, having the patience to answer these questions for us. We'll have the doctor back with us next week if we didn't get to your questions. But for now, we'll say thank you very much and we'll sign off. Thanks, doctor.
Okay, bye-bye.
Bye-bye.